Hello, welcome. I'm Dr. Darren, family medicine physician, and today we're doing health education on topics that you want most. This video is on my top 10 ways to manage chronic pain. 1 in 4 Americans live with chronic pain, a debilitating condition that significantly reduces the quality of life. So this is a really important topic that you need to know about. We're going to be covering medicines, therapeutics, procedures, and lifestyle changes. Now, if you like content like this, be sure to subscribe and leave a comment down below about any health topics that you'd like covered in future videos. In addition, if you have any questions, be sure to leave them down below and I will answer all of them. Now, before we get started with chronic pain, remember that these videos are for education purposes only. I cannot give personalized medical advice here. So if you're having any symptoms or if you're suffering from chronic pain, make sure that you go to see your doctor right away. Now, let's get started with my top 10 ways to manage chronic pain. Number 10 is acupuncture. In acupuncture, small needles are inserted into the skin at various places on the body in order to cause health benefits. When it comes to chronic pain, acupuncture can improve blood flow, it can reduce inflammation, it can make the brain less sensitive to pain, and it can reduce stress and anxiety, two things which are known to worsen chronic pain. Now, some patients will love acupuncture, some patients won't notice a difference, and some patients will not like acupuncture. But because many patients do benefit from acupuncture for their chronic pain, I do recommend that you give acupuncture a try, especially if you've tried multiple treatments and other strategies to manage your chronic pain and you have not achieved adequate relief. Number 9 is chiropractor. Chiropractors are known for practicing musculoskeletal manipulation on the body, also known as spinal adjustments. Now, these adjustments can be very strong. They can be painful, and oftentimes the goal with these adjustments is to crack the joints, and many patients like to have their joints cracked. Studies show that chiropractors can be good at reducing low back pain and treating headaches, and they might be also useful for treating neck pain. Just like with acupuncture, some patients are going to love seeing a chiropractor, others are not going to notice a difference, and some patients are not going to like seeing a chiropractor. Number 8 is surgery. Surgery for chronic pain can come in different forms. An arthroscopy is where the surgeon goes inside of a joint to clean it up or to make repairs. An arthroplasty is where the surgeon replaces a bad joint with an artificial joint. There's also surgeries that can be done on the spine to treat neck pain or back pain. A spinal fusion is when multiple vertebrae are permanently attached, eliminating the range of motion between those vertebrae, and this can reduce chronic pain. Or a laminectomy is where the back of the vertebrae is cut out, and this allows more room for the spinal cord. Surgery can be a life-changing treatment for chronic pain. However, surgery also carries the greatest amount of risk. Some patients who get surgery for chronic pain benefit a lot. In some cases, it doesn't help. And unfortunately, there are some cases where the surgery can make it worse. Because of that, most patients will reserve surgery as a last resort when they feel that they've exhausted all of the other chronic pain management options. Number 7, the SNRIs. SNRI stands for serotonin, norepinephrine, reuptake inhibitor. And this is a fancy way of saying that these medicines increase the amount of serotonin and norepinephrine in the brain. This includes medicines like duloxetine, which is Cymbalta. SNRIs work differently than most medicines for chronic pain. When you take an SNRI, like Cymbalta, it does not relieve your pain right away. Rather, it builds up in your system, so that over time, you notice a decrease in your pain the more often that you take this medicine. Patients typically notice a difference after 1 week, and they notice the maximum effect of this medicine after taking it for 4 to 6 weeks. Overall, SNRIs are very safe and effective, and they're an excellent option to use when you also suffer from depression and/or anxiety. Most people who take SNRIs do not have any side effects, but for those who do experience side effects, the most common is sexual side effects, that it can decrease libido. Number 6, muscle relaxers. This includes medicines like cyclobenzaprine or baclofen. Muscle relaxers can be very effective at managing various types of chronic pain, but they're especially effective when muscles are involved, and this includes muscle spasm or muscle cramping. Muscle relaxers can make you tired, and that makes these an excellent choice to manage chronic pain that keeps you up at night, making it hard for you to sleep. So then you can take a muscle relaxer in the evening to not only reduce your pain, but also make it easier for you to sleep. However, be on the lookout because muscle relaxers can make you feel tired during the day. Number 5, nerve pain medicines. This includes medicines like gabapentin or pregabalin. Nerve pain medicines are effective at treating a variety of types of chronic pain, but they're especially effective for treating nerve pain. With nerve pain, there may be numbness or tingling, and the pain may be radiating, such as down the arm or down the leg. Like muscle relaxers, nerve pain medicines often make you tired, making them an excellent choice to take in the evening to reduce your pain and to make it easier for you to sleep. Just look out for daytime fatigue. Number 4 is healthy weight loss. If you are overweight or obese, then healthy weight loss is very likely to help you with your chronic pain. Healthy weight loss decreases the amount of work that your muscles and joints need to do in order to support your body and to perform the activities that you do every day. Now, a good goal when it comes to healthy weight loss is to shoot for 10% of your body weight over the course of 6 months. And if you achieve this, this is very likely to produce a significant decrease in your chronic pain. Number 3, steroid injections. This is one of my favorites, and I perform these all the time in my family medicine clinic. A steroid injection is a mixture of lidocaine and steroid. The lidocaine is the numbing medicine, and that works right away and lasts for a few hours. The steroid is much stronger, and that gives relief for weeks to months. The steroid takes about a day before it reaches its maximum effect, so the day after you get the injection will be a good time to gauge how much this helped you. If it does help you, you can always do more. I inject shoulders, elbows, wrists, hips, knees, ankles, and feet. I can always do up to 2 joints at once. Now, we always wait 3 months before doing the same joint. So, for example, if I inject your shoulder and it gives you a lot of relief, but in the future the pain comes back, I can always inject your shoulder again as long as it's been at least 3 months. Steroid injection is a very low-risk procedure. When you do a steroid injection, because the needle is penetrating the skin, it's possible that you might experience pain, bleeding, or infection, or an allergic reaction, but these side effects are extremely rare, and I basically never see any of those side effects. One side effect that is more common is that it can raise your glucose temporarily for a few days. So this is important to remember if you have diabetes. Number 2, anti-inflammatory medicines. This includes medicines such as Tylenol and NSAIDs. Tylenol is available over the counter and is very safe and effective for managing a variety of types of chronic pain. However, Tylenol should not be taken when you suffer from certain types of liver disease. So if you have a liver problem, make sure that you talk to your doctor before taking Tylenol. NSAIDs are a broad, versatile class of anti-inflammatory medicines. This includes ibuprofen, which is over-the-counter naproxen, topical analgesics such as Voltaren, and prescription-strength NSAIDs such as meloxicam or indomethacin. These are all excellent options to manage different types of chronic pain. Now, if you suffer from chronic kidney disease, then you should not be taking NSAIDs on a regular basis. In addition, if you suffer from acid reflux, NSAIDs might worsen your acid reflux. So be sure to talk to your doctor if you suffer from chronic kidney disease or if you suffer from acid reflux. Anyone who takes NSAIDs, make sure that you take them with food. That way it doesn't hurt your stomach. Before we get to our number one way to manage chronic pain, we have a dishonorable mention. Opioids. Do not use opioids to manage chronic pain. I'll say that again. Do not use opioids to manage chronic pain. Opioids include medicines such as codeine, tramadol, Norco, Percocet, morphine, and Dilaudid. Opioids are the strongest pain medicines that we have, and that can make them a good choice to use when treating acute pain, such as if you just had surgery or if you were just in an accident. However, opioids are a bad choice for chronic pain because they're very dangerous. Opioids can make you feel tired. They can cause blurry vision. They increase your risk of having an accident or a fall, so it's very important that you're safe when you take these medicines. No alcohol when you take these, no marijuana when you take these, no driving when you take these. The worst part about opioids is that they're addicting and habit-forming. For all of these reasons, it's crucial that you not take opioids for chronic pain. Now, if you're already taking opioids for chronic pain, it's important that you work with your doctor to come up with a plan to safely get you off of these medicines and to replace them with safer medicines and other treatments for your chronic pain. And finally, my number one way to manage chronic pain: exercise and physical therapy. Exercise is beneficial to every part of your body, and it's extremely helpful for chronic pain. I recommend that you exercise at least 4 times a week, at least 30 minutes each time. It should be an activity that causes your heart to beat fast, makes you breathe hard, and makes you sweat. And these activities may include vigorous hiking, jogging, swimming, biking, aerobics classes, weightlifting, sports. I recommend that you choose activities that are the most fun for you. That way you'll keep doing them. And I recommend that you get others involved. That way you're going to be more likely to perform these exercises. Exercise has been shown to improve strength of your muscles and to improve the flexibility and function of your joints. And these changes make it easier for you to perform the activities that you do every day and experience less chronic pain. Exercise has been shown to decrease stress and anxiety, which are both known to worsen chronic pain. Exercise has been shown to be extremely helpful for chronic pain syndromes, such as fibromyalgia, rheumatoid arthritis, and lupus. When it comes to exercising to manage chronic pain, nothing beats physical therapy. Physical therapists are the experts when it comes to exercising to manage chronic pain. When you see a physical therapist, they will perform a variety of tests with you to assess your strength and your range of motion. The therapist will work with you to come up with a personalized exercise plan to manage your chronic pain. That's it for today. Those were my top 10 ways to manage chronic pain. Thank you for watching. Be sure to subscribe and leave a comment down below letting me know what health topics you'd like covered in future videos and if you have any questions. Remember, these videos are for education purposes only, so if you're having any symptoms or if you're suffering from chronic pain, be sure to go see your doctor right away. Bye-bye.